Hey guys, so last time I filmed a video on Rijuran and I actually got a lot of questions from abroad. So I'm actually going to film another one answering some of the questions that you guys gave me on my last video. So I'm gonna be introducing a new version, but before I do that, I'm gonna be showing you guys the originals that we have here in Korea. I don't know if this is actually exported abroad. So in Korea, this is the Rijuran Healer, and this is the I for the eye part, and this is the S for the scars. I actually talked about these last time. I didn't get to show you the scar one because I didn't really have it last time, but I do now. So these are the three versions that a lot of clinics in Korea actually have. And this is the newest version called HB Plus. I think HB stands for Hydro Booster. So it's a mixture of polynucleotide and hyaluronic acid and lidocaine. So apparently it's supposed to be less painful compared to all the other three. So I'm gonna try 1 cc of HB Plus on one side and the original Rijuran Healer on the other side. But since Rijuran Healer comes in 2 cc syringe, I think I showed you guys this last time. But actually the HB Plus one comes in 1 cc, and it's actually a pretty red one. So to make it even, I'm going to be using only half of this on one side and the entire syringe on the other side. And we're going to actually compare which one is better in effect and actually compare the pain part in injecting, okay? Last time I got this very interesting question. I'm gonna be showing you guys. So if you open the box, each box comes with like an introduction of what it is and like how to use it and like precautions and all that. So one of the questions was about one of the precautions of Rijuran injection. So this one person asked how many months after you can actually do this injection after you have gotten a filler procedure done. Usually to my patients, I say at least 4 weeks apart. If you've done filler first, then you should wait at least 4 weeks before you do Rijuran. But if you do Rijuran first, it doesn't really matter. So as long as all the injection sites have healed, then you can actually go on and do the filler procedures whenever, okay? It says here in the precaution part, it actually talks about how many weeks you need to wait until you do filler. At least in Korean it does. I'm gonna find it in English. I'm having a hard time finding it in English, but in the Korean version, contraindication number 1. So this is actually a contraindication that Rijuran Healer has put as number 1. Patient with history of unabsorbable filler or recent other filler treatment. So it says other recent. So what does recent mean, right? So I've actually contacted Pharma Research and asked them what they mean by recent. And they gave me an answer saying that it should be 2 to 4 weeks at least. So just to be safe, I tell my patients to come after 4 weeks after they've gotten the filler injections done. Okay, so this is actually in here in many languages. It's in English, Chinese, Japanese, and Korean. So I'm guessing it's being exported to all these countries that use these languages. Okay, so that was one of the very, very important precautions that a lot of patients ask, because a lot of patients get fillers done. Okay, so I'm gonna start with Rejuron Healer first because this is painful, more painful at least. Okay, and then like I said, to be fair, I'm gonna be using only 1 cc, half of it. Rejuron Healer is only composed of polynucleotide, so it's very effective in rejuvenation and resurfacing of the skin and dehydration. Okay, especially because in Korea it's so like cold and dry during the winter time. A lot of patients, they feel dehydrated in the skin, and that's why they come in to get the procedure done. Usually recommend 2 weeks apart for 3 procedures, and the procedure can go up to like 6 or even more. If it actually depends on how dry your skin is. Okay, I'm gonna start with Healer first. This patient has been numbed using numbing cream for like 60 minutes now. I'm gonna show you what it looks like right after the procedure. Very important that you inject right into the dermis part. If it goes deeper than that, then it's gonna be less effective. So make sure you inject it right into the dermis. You can actually tell if you're injecting it into the right part of the skin because you can actually see the solution make all the embossings if you're doing it right. Obviously, it's going to be less painful if you inject it deeper, like into the subcutaneous part, but it'll be very much less effective, so I don't recommend doing that. This embossing I'm going to be showing you guys after I'm done. It will go away after about like 2 days. Actually like 24 hours. In my last video, I've actually talked about what polynucleotide is and why you should recommend Rejuron to the patients. So if you want to learn more about Rejuron itself, then you should actually check out my other video, which is also in English. This video is actually going to focus on comparing the Healer, the original one, versus the HB Plus, which is the newest one. I'm not going to be talking much about components and such. Some of the clinics in Korea, they actually sedate their patients while doing this procedure, which I strongly do not recommend doing. Numbing cream is perfectly okay. It's enough. You don't need to be sedated, because if you're under sedation, you actually move a lot. So it's going to be very dangerous because I'm injecting, obviously, and if you move, I won't be able to inject it into the right part of the skin, number one, and number two, I might poke you elsewhere where I'm not supposed to, and it can just become a disaster. So I really do not recommend being sedated while doing this procedure. Okay, so this side I'm done. I actually used only half. So 1 cc of Rejuron Healer I've used. I don't know if you guys can see. Okay, so on this side I'm gonna be using the HB Plus. It's supposed to be less painful. Oh, and by the way, this HB Plus, you need to keep it refrigerated. I think all the other ones, they're all room temperature. You need to keep this refrigerated. The temperature should be between 2 to 8 degrees Celsius, okay? Okay, I'm gonna be starting on this side. Since the particle size of the polynucleotide is so big, it's painful when you inject the syringe needle into the skin. That's when you get the first pain. And the second pain comes when the solution goes into the dermis. The polynucleotide, like I said, that's only because the particle size of polynucleotide is so big. And this HB Plus is a mixture of hyaluronic acid, lidocaine, and polynucleotide. So the percentage of the polynucleotide, I think I'm not sure about this, I'm gonna have to check. But apparently, of course, it's less than the original one. Because there is less of polynucleotide, of course it's going to be less painful, and plus there's lidocaine in here, so it makes it a lot more less painful. So with the HB Plus, it's only painful when the needle goes through the skin, but not that much when the solution is going in. And in my experience, the Embasing of Regeneron Healer, it lasts about 24 hours. And this HB Plus, it lasts, I think, a lot more than that. I think it lasted up to like 48 hours or so. So if you have like an important date coming up, then I recommend you do this like at least a week in advance. That is at least. If you want to see the effect of it, you need to at least wait like 10 days. Because the HB Plus has hyaluronic acid mixed into this, and the solution is actually a bit gooier. I think that would be the right word. Not thicker, but a bit gooier than the original one. I'm actually running out of space to inject, but I should use all of this 1 cc to be fair, right? I really have no more space to inject. I actually have like 0.3 cc's left. So that means I've used 0.7. I really have nowhere else to inject. So I'm gonna stop here and show you. So like I've said, I have nowhere else to inject, so this is 0.7 cc's of HB Plus, and this is 1 cc of Healer. You can already see that the Embasing has absorbed into the skin. The side I've just injected, so obviously you can see the Embasings very clearly. Okay, so the pain level, very much less compared to the Healer part. Especially down here, she felt like barely nothing. So the lidocaine works, obviously. And the redness is gonna last about like 1 or 2 days, and the patient will probably feel a lot of heat after the procedure, of course, because so much injections, so much needling has gone through the skin. So if the patient hasn't gotten anything else done, only Regeneron that day, then like cold massages, perfectly good for the heat and the redness. Not much of swelling after a Regeneron procedure, unless you've gotten like, I don't know, filler in the recent time period. But the swelling will go away. in like less than like 5 days or so. I've done so many Regeneron procedures at my clinic, but I haven't really seen any side effects. Like bruising and like redness and heat, those are not side effects. So like actual side effects or contraindications, I haven't really experienced because obviously Regeneron Healer only is composed of polynucleotide. But with the HP Plus, if you are allergic to lidocaine, then you will have allergic reaction to this. So you might want to tell your doctor if you have allergies with lidocaine as a precaution. But other than that, I can say that Regeneron HP Plus, the original, they're a very safe procedure to do. If you have dry skin, I highly recommend. And after the procedure, actually, you'll experience a bit more dryness than before. That's a part of the rejuvenation of the skin, so that's perfectly fine. And after probably a week or so, it's gonna all go away. So no worries about that. But today's video is going to focus on the pain part. So obviously the HP Plus, a winner compared to the original, but there are pros and cons to this because this is actually 100% polynucleotide, whereas this only has a lot less percentage of polynucleotide. So if you want rejuvenation, resurfacing, and you want to treat the dryness of the skin, like dryness from the inside, then I actually recommend getting Regeneron Healer done compared to HP Plus. But if you are really afraid or have phobia to needle injection procedures, then you might want to try out the HP Plus, but you might need more number of treatment compared to this one. Well, that's an obvious. Less percentage of polynucleotide and less cc's. So you do the math. But with the pain part, this is the winner, as our patient said. And that's it for today. Thank you. Bye, guys.